Welcome back to Face the State. I'm Ariana Bennett. Thank you for staying with us. Well, according to the CDC, more than 80 people in at least 14 different states were diagnosed with the measles just in the month of January this year. Now, the disease was considered eradicated in the U.S. 15 years ago, but last year the country saw a major resurgence of cases, and this year seems to be following that trend. Dr. Trudy Larson with the University of Nevada School of Community Health Sciences is here to discuss the virus and the vaccine. Trudy, thank you so much for coming on the show.
It's my pleasure to be here.
Okay, so I want to start generally talking about this measles outbreak. I know it's very rarely fatal, but how worried should we be?
We should be very worried. Most of the cases of measles in the United States are actually imported because traditionally we've had very high rates of vaccine, and at 95% you effectively stop any epidemic. Have we fallen below that? We have. And so now we are seeing outbreaks that are starting to get larger and larger. Measles really is not as safe or as
benign,
difficult, or it's a very dangerous virus. Just to give you some comparisons, 2 in 1,000 people will die. That's a very high mortality rate. 25% in many outbreaks are hospitalized. The older you are, the sicker you get, or if you're an infant less than 12 months of age, you get very ill. So that's where you see the most of the hospitalizations. So it's not a benign disease, it's very dangerous, and people forget because it's not around very much anymore.
Right. Why isn't it around?
It's not around because we have vaccinated. The vaccine came out in 1963. It was readily accepted because almost everybody then had measles, remembered it, may have had family members who got quite ill. So for them, it was a miracle to be able to protect their children. Now, we haven't seen a lot of measles. Most doctors that were trained in the last 20 years have not ever seen measles. They don't even know how to diagnose it. That's how successful we've been. But because people don't see this virus anymore, I think they get complacent and feel safe, and they shouldn't, because the virus is all over the world and is easily imported.
And it has a lot of complications, right?
It does. There's a lot, ear infections, pneumonia, encephalitis is probably the worst, and then of course death. And that's a very high death rate. Most of our infections really don't have that kind of an outcome, but people forget. It's not an easy virus really to get along with. And then you're uncomfortable. You have a fever, you have the rash, you're uncomfortable. Days and days, 21 days. That's how long this infection really lasts.
It's a lot of missed work or missed school.
Lots of missed work, lots of school. And I think if you look at the economics of it, it's extremely expensive in terms of those absenteeism days for parents in particular.
So this drop in vaccination rates, what would you attribute it to?
Well, I would attribute it, it actually comes from a study that was done in the in the middle 1990s by Dr. Andrew Wakefield. And he published a paper that suggested that the MMR vaccine was associated with a very unusual constellation of symptoms, one of which appeared to be like autism. And it was published in a reputable journal, so folks really looked at it and said, oh my God, what are we missing here? Now, fast forward, his work has been shown to be fraudulent. He has been disbarred from the medical profession in Great Britain for the lies that he actually put in a British journal. And so it has taken 20 years of science now to really prove that there's absolutely no link between autism and MMR. But somehow that's gotten into the framework of how people think about vaccines, and they're worried. And I agree, parents should be worried, and they should be quite vigilant in looking at what their children are exposed to. But these vaccines are very safe, and when the science says over and over and over again, there is no link, they need to believe that, and they need to protect their children.
Now, there are, it's kind of a big host of concerns that parents have where vaccines are. I'm just going to run down a few of the concerns. So one of the big ones is that there are additive chemicals in the vaccines other than the, the dead virus itself or the, weakened virus itself, like mercury, aluminum, formaldehyde.
Right.
Is that still in the vaccine, and is it harmful?
Almost all of those chemicals have been removed from the vaccines. We have modern manufacturing methods, and so they've taken them out. But just to let you know, people have actually really researched those questions. Is aluminum associated with any bad outcomes? Is thimerosal, which is an unrelated, it's a mercury compound, but it's not related to the bad mercury. And those studies have shown convincingly that there is no association to bad outcomes. Again, it's a reasonable thing for parents to ask, and certainly formaldehyde, that scares you, but in the small proportions that have been in there, and I think one of the great analogies that I have heard is that aluminum is everywhere in our environment, and we're exposed to it all the time in far higher doses than anything that was in the vaccines. But again, it's okay for parents to ask, but then they need to believe the science. And the science says these have no effect on their children.
Okay, now another concern. Okay, I read actually a lot in my research on this that the healthcare system pushes vaccines because it's profitable, not because they're effective.
Oh, I wish you could talk to some of the pediatricians I know. Giving vaccines is almost not, is a break-even, well, almost a break-even proposition. Sometimes it costs pediatricians money to give vaccines. These are very expensive, but they believe in what vaccines do. They protect children's health, and that's what they're there to do. So this is not profitable for a physician who's giving these vaccines. It's actually barely profitable for many of the manufacturers anymore because they've been around so long that they do not charge as much as they used to, and there are huge numbers of doses that are given out, so each dose is not that expensive. I understand the issue about profit margin, but when it comes to children's health, these vaccines have done more than any other advance in science, really, to have children be able to attain their adulthood.
Now, there are some doctors who actually do support some of these concerns and these claims. Why do you think that is?
You would have to ask them. I have a really hard time understanding it. I think the science is so overwhelming that I find it a real disservice to parents when they have professionals who've decided to sort of bend the science a little bit, or maybe they're totally convinced, but there should be heavy skepticism because the CDC, physicians, the whole health industry does advocate for vaccines because they work. We know they work.
Right. Now, it's not just about your child either. Obviously, that is a big factor, but it's also tied to herd immunity. Do you want to explain herd immunity?
Herd immunity happens when you have a certain percentage of the population immune. For whatever reason, whether it's natural disease or a vaccine, they're immune, they can no longer get infected. And when enough of the population is that way, they protect folks who may be susceptible. And so they're not bringing in viruses or bacteria to expose people who are susceptible.
And we're talking about maybe kids who are too young to be vaccinated, or people who are immunocompromised.
Yes.
If they have disorders, they can't be vaccinated, or they're allergic to the vaccine, or kids fighting leukemia, something like that.
Right, and they can't be vaccinated because if they do, they really don't mount an accurate response, so they're not protected. So they're susceptible. And so this herd immunity protects those susceptible people from getting ill. I mean, I've heard a lot of pleas from parents whose children are on steroids for asthma, they're immune suppressed, or who've had transplantation, or who have leukemia, to please to their classmates, parents saying, please immunize your children so our children can be safe. And that's what herd immunity does. And so the recent outbreaks in Disneyland, that's truly about a lack of herd immunity. Too many susceptible kids, perhaps not immune compromised, but susceptible people unvaccinated who were able to then bring disease. And then the question is, who are they bringing the disease to? And might those small babies or immunocompromised folks have a really bad outcome?
Now, we still, I mean, especially compared to other countries, have really high rates of vaccination. If the number continues to drop, even by a small amount, what kind of picture are we looking at medically?
Okay, so I can already tell you. So we have these outbreaks of measles, they're becoming more common. We've had outbreaks of mumps, also related to importation from outside and an unimmunized population. We have a big pertussis epidemic in California that's just as big as the one 3 years ago. And so I think Those are all vaccine preventable diseases. And so we're starting to see what happens when vaccine rates go down on a population level, much less what it does to individuals who really sometimes can't mount a good response to these different kinds of pathogens.
Is there a number that we need to hit in order to be safe?
95%.
Where are we now?
Oh, we are at usually, it's right hovering at 95%.
Okay.
But it's lower in some parts of the country. And so in those parts of the country, we are losing herd immunity. There are enclaves, counties, particularly in California, where those choices have been made, and those children and probably their parents in some cases are highly susceptible. We lose herd immunity when we don't maintain those levels.
And it happens a little slowly, so it's not like an immediate thing that you see. Once it's on the path, it's maybe a little harder to slow it down.
It is, and currently, because our vaccine rates are high, it's required for school, which is probably the best way that we get our children immunized completely. It's required for school. So that's kept the level high. So it's in some of the younger groups where there are some choices that can be made in certain states. I'm very proud of Nevada. I think we have a really well defined program that says, no, just because you don't want to, you can't opt out. You have to have a medical condition or a religious exemption. So that helps protect our kids in Nevada.
All right, Trudy, thank you so much. Great information. I appreciate
Thank
you
you.
coming on the show.
It's my pleasure.
That is it for this episode of Face the State. But for more information on all of this or to see past episodes, just head to our website, ktvn.com. Thank you so much for joining us. We will see you next week.